Hello and welcome to the Legal Edition. I'm your host, Attorney Mary Kay Elloian. Our show topic today is toxic teeth, toxic truth, Mercury, amalgams, and the FDA. We will also be discussing how to achieve whole body health in part 2 of this series. Our guest today is Dr. Mark Breiner. He is the author of a fascinating in-depth book on the use of mercury amalgams, their use, their effects, and their classifications as hazardous waste everywhere but the human body. Let's welcome Dr. Breiner. Welcome, Dr. Breiner.
Thank you for having me, Mary Kay.
Great to have you with us. Can you start by telling us a bit about amalgams? What are they?
Well, amalgams, a lot of people know by the name of silver fillings, which is a misnomer because half of the filling is mercury, so really it should be called a mercury filling. And the other half is copper, tin, zinc, and silver. And all of them carry potentially a problem, and especially the mercury half.
Now, mercury, as we know it, is a neurotoxin. We know it's hazardous waste in the environment, and we know that we have to be careful of eating fish. So how can mercury be put into the human body and be deemed safe?
I wish you could answer that for me. I have no idea. The American Dental Association and the FDA continue to say that it's safe. It makes no sense because if I were to use that, which I haven't in over 40 years, the mercury I'd have to handle, and they come in capsules now, I'd have to handle that as a hazardous material before I ever place it in the mouth. And when I take fillings out, I have to handle it as toxic waste. It seems that the only safe place in the entire universe, according to the FDA and the ADA, to store mercury is in somebody's mouth. It's nonsensical.
I mean, that's counterintuitive.
Yeah, very.
You know, I was reading some of the FDA reports, and as most people probably don't know, the FDA is part of the Department of Health and Human Services, the same department that talks about, you know, the need for vaccines, and they oversee the FDA. And the FDA is saying that these fillings are safe. They're safe for anyone over the age of 6. However, in reading the literature, they coyly wrote that there is some low-level exposure of vapor coming off these fillings that may be toxic to some people. Can you expound upon that?
Well, that's really the big problem with the fillings, is mercury comes out of those fillings 24/7. There's always mercury vapor coming off, which is a very dangerous form because it's readily absorbed, goes right to your lungs, goes right to your brain. And that's why studies have been done, show the amount of mercury in the brain will directly relate to the number of fillings a person has. In autistic kids, because it passes the placental barrier, goes right to the fetus. It's stored in mother's milk, so even they've done studies and shown that kids with autism, the worst cases of autism the mothers have relate to the number of fillings and surfaces that the mother has. So this vapor is always coming off. And when you think about it, Mary, we breathe about 17,000 times a day. Now, yes, it's a small amount that is coming off, all right, but you are breathing 17,000 times a day. You're taking in that vapor that's coming off. And it takes 30 to 70 days to get rid of half of that dosage that you've just inhaled. So you can see how it's going to accumulate in a system. And everybody is different. Some people have more compensatory mechanisms. They'd be able to accumulate more before you start to show changes in physically. And others are very, very sensitive. And they can start to accumulate just a little and can start to show symptoms. So it's very insidious. It's terrible. It should not be placed. Any toxicologist will tell you that mercury is toxic. And I don't care what form it's in, mercury is toxic.
What's interesting is several countries outside the U.S. have banned the use of mercury amalgams. Sweden, Denmark, Norway, I believe Japan, and Canada may be one of them as well. Can you?
They haven't banned yet, but a lot of the countries that haven't banned it in Europe are putting limitations, saying not to place it in pregnant women, not to place it in children under 6, which is interesting too, because the FDA on their website talks about mercury being a neurotoxin when they're talking about mercury fillings, and you should be careful children under 6 and pregnant women. So I don't know what the difference is between somebody that's 5 years old and 5.5 years old and a 6-year-old.
Well,
it makes no sense.
Well, it doesn't make any sense, because if it can cross the barrier to the fetus, or it can be in the mother's milk, or it can be anywhere. I mean, I don't understand how they can set the parameters at age 6.
I don't know.
Makes no sense.
No.
Okay. So, but other countries are catching on, and they have caught on. They've banned it. Now, I know in many states, including here in the state of Massachusetts, they've passed a law where their dental offices are required to have what's called an amalgam separator. Can you tell us what is an amalgam separator?
Yes, in Connecticut we also have that law. Essentially, a lot of mercury in the waste stream comes from dental offices. So now what we're required to do is to have a special trap to catch the bits of amalgam that are taking out of a person's mouth, so it's not going into the waste stream. It seems that we care more about the fish than our kids.
It's unbelievable what's going on. And what I've read with the EPA, there is 30.4 tons of amalgam sold each year, and that it goes into the U.S. market. Actually, that's the EPA had done a study in 2004. It was a study that was done for the EPA by the Interstate Mercury Education and Reduction Clearinghouse, the IMERC. So 30.4 tons of amalgams are sold that year in 2004, and it goes into the entire U.S. market. That's like incredible.
It is. It is.
I mean,
and think of placing that into people, implanting it into teeth, and worrying about the waste stream. Well, just think. So they've shown that the mercury, a certain amount will be retained, some will pass out through the feces and urine. And that's going out into the waste stream.
Right.
So, we need to worry about the internal environment also and what we're doing. So it, we have materials today that are better from a restorative standpoint, from an environmental standpoint, and for the health of the patient. There are materials that are better. So to continue to use these fillings, it is a travesty. It just should not be done.
Speaking of a travesty, I heard that the Department of Social Services, I believe in Connecticut, has mandated that children, or perhaps anyone using the services of Medicaid, have to have these silver fillings, quote unquote.
Right. They've gone and said that any dentist who wants to get reimbursement cannot place what is called a composite filling. They have to place a mercury filling, or they won't be compensated. So essentially, dentists like myself who don't place mercury fillings would not be allowed to treat a Medicaid patient.
I mean, that's like dental tyranny.
Yeah.
And talk about social injustice. That seems to be exploiting the most vulnerable people in society, the poor who don't have a choice.
Absolutely.
And that seems really wrong.
So hopefully that's going to be corrected. We were up in Hartford and trying to make sure that gets changed.
Well, I hope so. And I think other people need to take heart of this and in their states petition and talk to their legislators about some of these issues. And there's also the issue of informed consent. I have, through my own research, found that informed consent is not being done across the board. People don't know that they can have a composite filling, and they don't know what could happen if they have an amalgam filling. Why is that happening?
I think it happens because the Dental Association continues to tell the dentists that these mercury fillings are perfectly safe. I mean, dentists aren't in the business to harm people. That's why they don't go into to do dentistry
Right,
to
of
harm
course,
people.
of course.
But they sincerely believe that there's no problem. Many dentists will go and say, look, I have mercury fillings in my mouth, and I have in my children's mouth, and they're perfectly safe.
Well, let's talk about that, because from what I understand, dentists have a high rate of illness, and there's been a high rate of suicide, a high rate of illness. Do you know of this personally with any of your colleagues?
Yes. I mean, I know a number of colleagues that have some serious illnesses, but there was a study done by Dr. Toplinski at Yale, and he's a dentist in Connecticut, and he went through prescriptions that had been filled and studied, and he found that general dentists versus a dentist who's, say, doing orthodontics that really isn't exposed to this, have a much higher rate than the average person for serious disease.
Any specific disease or cardiovascular?
It was cardiovascular, I believe. And there are also studies showing, that dentists, especially female dentists, dental assistants, have a much higher rate of infertility.
That's unbelievable. And this is continued to be allowed by the FDA and the EPA.
Yeah, I don't know when we're going to stop arguing about whether a toxin is a toxin or not.
Exactly. It's a circular argument.
Yeah, and one thing that came to mind that I find interesting when they're talking and saying it's only a little bit. Don't worry.
Right. Low level.
A 4-foot fluorescent light bulb will have maybe 8 or 10 milligrams of mercury. The compact fluorescent lights, which have been mandated, which also is a huge environmental problem, has about 5 milligrams of mercury.
Oh, really?
Guess how much is in your average molar filling?
I have no idea.
750 to 1,000 milligrams. Now, you're not allowed, you're not supposed to throw these fluorescent lights into the garbage because of the mercury that will be released.
Right.
And that's why, technically you shouldn't take a tooth with a mercury filling. Has to be handled as hazardous waste. If you take that molar with a mercury filling in it and put it into a 10-acre lake, you cannot eat out of that lake, the fish. So,
wow,
it is not that little,
Right, right. And from my research too, they were saying, actually the EPA was saying that if any of this mercury from amalgams goes into one of those wastewater treatment plants, if it gets in there, they can separate 90%, but they don't say what the 10% is. And I did some calculations, and the calculations are staggering. I mean, the calculations were like 3/4 of a ton based upon what they were saying, the amount of mercury that is usually taken in by a wastewater treatment plant. So I find it unbelievable that the EPA has these figures and they're just throwing around and minimizing it while people are getting sick, very sick, and don't know why they're sick. So not only does it drive the cost of health care up, it's making people less productive. They'll miss more days of work. I mean, they're going to be sick, but nobody seems to care.
No. They're trying to reduce mercury. That's why I want to shut down the coal plants, because it's a byproduct of the coal industry. They have all these limits on the amount of emissions of mercury coming out of all the, generating plants, electric generating plants. They're worried about all these sources of mercury. You can't buy a mercury thermometer anymore.
Right.
And they've taken it out of over-the-counter things, but
Appliances.
yet in the mouth,
it's okay.
It's okay.
And in the mouth, you're dealing with different acids, different byproducts that will help erode it. And one of the things I found very interesting, they talked about ways that vapor can come out, but they didn't talk about bruxism. They didn't talk about grinding, because grinding is it's a byproduct of having that temporal mandibular joint dysfunction, TMJ, as we know it. And they don't talk about how much amalgam vapor is vaporizing into the lungs of the person who unwittingly grinds their teeth.
They try to say it's only a little bit, but anything that stimulates that filling, whether you're chewing, drink something hot, drink something acidic, brush your teeth, anything like that causes about 15 times the amount of mercury to come off the fillings. So I've had patients that use electric toothbrushes and have had migraines.
Really?
And have problems. And when they come in, one of the first things I'll just say is, you know, to use an electric toothbrush. And if they say yes, we'll stop using them while you have these fillings in your mouth. And just doing that, cutting down the amount, some have noticed improvements.
Really? It seems it's just unbelievable what's the effects that these things are just having. So we find out that, well, in the state of Massachusetts, they've passed this law about the amalgam separator, but they have not passed them, I believe, in every state. It's up to the environmental protection of that each and every state to say, you know, you need to do this to protect our wastewater. Because from what I found out, there's different kinds of mercury, and that mercury bioaccumulates. Even the EPA talked about bioaccumulation. That also, additionally, what they didn't talk about was that mercury in the gut flora can change the type of mercury from elemental to methyl mercury, which I believe is the most toxic.
Yes. It's very interesting. These things do go on in the gut. And there's also a study that's fascinating. They showed that bacteria, when they bind with the mercury, they become mercury resistant. And those bacteria become antibiotic resistant. And we all know what a problem it is today with antibiotic resistance.
Right.
So that's another effect that the mercury fillings is having.
And no one's talking about that.
No. That was a study done a number of years ago by Ann Summers and showed that effect.
Well, we know that amalgams travel, the mercury travels. There was a study done in sheep and they were done in monkeys that they did with radioactive, I believe, isotopes, and they followed it. And they found that, I think within 4 weeks, it was in all the organs of the body. They did it both in sheep and in monkeys. And I believe they did a study, I think, here in Massachusetts as well on children. But that was not as definitive as the ones done because I think there was some issues that weren't addressed properly. Can you expound on that?
Well, the studies on sheep were done up at the University of Calgary. And matter of fact, Dr. Vimy, a friend of mine, was in on those studies. And what they did is they took mercury fillings, they radioactively labeled that mercury, and they put fillings into the sheep. And like you say, what happened was then they were able to follow exactly where that mercury went. It went to all the tissues and organs, especially accumulating the pituitary. And they did other studies, same sort of thing, where they showed that the mercury past the placental barrier goes to the fetus. And they did it on monkeys. And they showed in 30 days in monkeys a large impairment of the kidney function. That study, those studies, I should say, the ADA chooses to ignore. They give all sorts of reasons why they were in monkeys and they were in sheep. What does that have to do with human beings?
Yes, there was a sheep study that they found impairment of the kidneys as well.
Right. So the one they like to cite, there are two studies, one done in Massachusetts and one done in Portugal on children. And they took children, I believe they were between like 5 and 10 years old. And they took a control group, they put composites in, and they took another group and they put mercury fillings in. They, at the end of 5 years, did testing on them and said, there's no neurological impairment, these kids are fine, we don't pick up anything. So it proves that it's safe. So they love to cite the study.
So what was wrong?
Well, there were a number of things wrong with it. First of all, I think to take a known toxin and plant it into children, there's something wrong. Yeah, I'm not sure legally you know more about that.
It's unethical with what we know, what we're discussing.
Because I'm sure they didn't tell you about the potential side effects of mercury in the body.
And
they
then
didn't inform the parents.
Consent, right.
But the other problem was that they measured urinary excretion. Now, it's interesting. So it showed mercury goes out into the body off the fillings because they showed increased urinary excretion. But they didn't measure, number one, they didn't calculate how much mercury was coming off the fillings. They didn't calculate the major route of excretion is the feces. They didn't check that. They didn't allow for the fact, number one, that these kids also, these were baby teeth, so the teeth would be lost over time. And number two is, like you said, there's a bioaccumulation. This is accumulating like a slow dripping faucet, slowly. So yeah, maybe in 5 years you didn't get huge changes, all right? The other problem was it was all done on an average. So you may have kids, there were kids in the study that did show changes, but others didn't. So when you average it out, they say, okay, it's all right. But we know that there's something called ApoE, which is a protein that binds mercury. If it's ApoE 2 and 3. APO4, they don't bind mercury because there's no sulfur, and sulfur loves mercury.
Right.
If they've shown that autistic kids, all right, if you're ApoE4 and you're not good at excreting mercury, much higher incidence and severity of autism. Also Alzheimer's.
Really?
So, because,
And nobody's testing for people with Alzheimer's if they have this.
Nobody's testing that. You know, the ADA and the FDA said don't place mercury in people that are allergic, but nobody's even testing if anybody's allergic to it.
Right. So, I mean, the whole facade is that mercury is safe, but we know from the test, and I'm sure they didn't put radioactive isotopes in the children to find which organs they went into, because that would be truly unethical.
Yeah, no, they didn't
They didn't do that. And also, too, we know it bioaccumulates. The EPA even admits that. So check those children in 50 years, and let's see what happens.
Right.
And what, health problems they're going to be having then. I mean, this is just a travesty against human beings in our nation, and even abroad in these low-income countries, too. And to be mandated by DSS, I think, is just deplorable, just absolutely deplorable. Dr. Breiner, there are other materials that can be used instead of amalgams. Is that correct?
Yes, there are. And, that's one of the things the ADA likes to say, that the mercury filling is really still the best filling out there. And it isn't. The mercury fillings over time, what happens is they corrode, and as they corrode, they start to expand and they start to split the teeth. So that people, as they age, find now that the teeth fracture, they may be into a root canal, or they're into crowns, they're into much more extensive dentistry. What we usually use is a composite material. It's a plastic glass material that we actually go through a process and have it bond to the tooth. So the tooth is much, much stronger. And besides the fact you don't have mercury coming off of it, it's also tooth colored, so it's much more aesthetic. And if we do have to go to a crown, we also have materials that are non-metal and are tooth colored. So we can pretty much avoid the metals altogether.
Because not only is the mercury toxic, but there's also some electrical problems that can result from having different metals in mouths. And we're going to talk more about that in part 2. So people have options. There are several options that probably will even work better than the amalgams with regards to the tooth structure staying intact.
Well, one of the things they also like to say is that these composite fillings don't last.
Yes.
And if they're properly placed, the studies show, number one, they last as long as a mercury filling from a strict scientific point of view. But I've had some of these in 25, 30 years. So if they're placed properly, they certainly last, and that's not a problem.
So it shouldn't be a problem if it's done correctly. So in part 2, we're going to be talking about how people can get healthy, because there are ways, and I know you've had many successes in treating many of your patients and having them get well and moving past this mercury toxicity. And we'll talk at length in that. Is there anything else that that you feel that people should know about what's really going on here, the FDA and the EPA and some of our governments, and what they can do?
Well, I think the main thing is to write to your congressmen, your senators, and tell them that you really would like to see this banned. I mean, I thought 40 years ago I said, oh, in 5 years this will be banned. And then 35 years ago I said, 5 years this will be banned. I don't know. I mean, that's one of the reasons I wrote the book. Mm-hmm. I think it's important for people to be educated.
And it's an award-winning book. The book is Whole-Body Dentistry by Dr. Mark Breiner. It is truly an enlightening experience. Everyone should read that to be educated about what's really going on in the dental industry.
When you're educated and you tell your dentist, I do not want mercury fillings.
Right. Be the informed consumer.
Mm-hmm.
Don't wait to, there is a law that says you inform consent. Be proactive.
Absolutely.
Read the book. Well, it was great having you with us. Just like I said, I can't say enough. I've learned a lot myself. I've applied it to my own life, and we'll be talking about those stories in part 2.
Very good.
Thank you for being here. I want to thank our guest, Dr. Mark Breiner, for sharing his research and experience in the area of mercury amalgams and for being a good dental detective. I also want to thank you, our viewers, for tuning in. For more information on today's topic and our guest, please visit The Legal Edition online at thelegaledition.com. And as always, this information is for general educational purposes only. It is not to be construed or relied upon as legal, business, or medical advice. And please consult a qualified practitioner as to your particular legal, business, or medical needs. Again, thank you again for joining us, and we will see you for part 2 of this topic on The Legal Edition.